Good afternoon and welcome. My name is Sean Madden and I'm a Vice Consul at the United States Consulate General in Chennai. Thank you so much for joining us this afternoon. 2020 has been quite a year. We are experiencing an historic and unprecedented year where communities are impacted by floods, earthquakes, and of course, the coronavirus pandemic, to name just a few disasters. Recently, the United States Consulate General in Chennai completed a project called America with Kerala that involved a series of awareness building events involving meetings, workshops, media engagements, and interactive programs focused on disaster preparedness, management, and resiliency in 3 major cities in Kerala. We are also working to develop and promote a disaster management curriculum for a new 40-hour elective course to be incorporated into existing academic programs of universities, autonomous colleges, and other relevant governmental and non-governmental agencies across India. We continue to engage in this topic that is of strategic importance and priority, not only to the United States, but to India as well. Emergencies and disasters have a habit of striking quickly and without warning, forcing people to quickly leave or to be confined to their homes unexpectedly. That is especially true for the millions of Americans who have disabilities, where emergencies such as fires, floods, and other disasters present real challenges over and above those which they already face. In the United States, the Federal Emergency Management Agency, we call it FEMA, is responsible for coordinating the federal government's response to natural and man-made disasters. It makes sure that people with disabilities too have access to and can benefit from their programs and services. India is prone to acute natural disasters impacting the most vulnerable populations, especially people with disabilities. The World Bank estimates that between 55 and 90 million Indians have some form of disability. Disasters often introduce several new physical and social barriers that aggravate existing challenges. For example, persons with visual or oral impairments may have difficulty receiving early warning messages. Persons with intellectual or mental impairments may not even understand what warning messages mean or how to react. People with disabilities face discrimination and exclusion from care systems. That brings me to our very special guests this afternoon, who are here with us today to discuss the successes and the challenges in bringing about inclusivity in disaster management practices. It gives me great pleasure to introduce to you our wonderful guests, Mr. Justin Jasudas, a para-athlete who participated in the United States Department of State's Global Sports Mentoring Program. Mr. Joe John George, State Project Officer for the Kerala State Disaster Management Authority, and an alumnus of the United States Department of State Exchange Program on Crisis Management and Resilience in coastal India. And Ms. Shruti Raghavan, Senior Program Officer, Education and Media, Ability Foundation, Chennai. Thank you, Justin, Joe George, and Shruti for joining us. And I would also like to thank the Kerala Disaster Management Authority and the Ability Foundation for their collaboration on this engagement. Before I invite the speakers to speak and ask some questions, I would like to let the viewers know that we're going to have a question and answer session at the end of this discussion. Please type in your questions into the chat box that appears at either side of your screen or below your screen, depending on your device, and we will have our guests address them. So, Justin, my first question is to you. You are a wheelchair-enabled athlete. During your lockdown, you were home alone for a few weeks. What has been your personal experience?
Thank you, Sean. Good afternoon, everyone. Yeah, it was indeed a very unique experience. As a person paralyzed neck down, I spent about the first 5 to 6 weeks of the lockdown in complete isolation, and in the first 3 weeks with absolutely no access to supplies and deliveries. There was also uncertainty in terms of how long this would last, because my family couldn't get back because of the lockdown restrictions. Well, of course, I later read that there were notifications that persons with disabilities can reach out to caregivers, helpers, and their movement would be allowed. However, the willingness of the helpers to come was a big question. They were very reluctant for obvious reasons. Unfortunately, I had the education experience and rehabilitation to get through this, but the first 2 weeks were very difficult. But thereon, I was able to adapt. I kind of rational my supplies, made some lifestyle changes by reducing meal, went with just two meals a day, switching on to vegetarian diet because getting some of the groceries and vegetables were a challenge, so that I'd be able to stretch the resources that I'd have. On the other hand, I also, while I wanted to get back to my family, or I wanted my family to come back, my wife and our 15-month-old twins, they were in another state. So making the toddlers travel probably was not a wise thing to do. And if I had to move where they were, there was no clarity in terms of what was the quarantine protocol for a person like me. Would it be accessible? Would all the facilities be there for me to, move around? And when I tried reaching out to the authorities for the e-pass, the obvious thing was why a person with such high disability, neck down paralysis, should even travel in the first place. The ability was not there, but the disability was questioned. Uh, when we got beyond that question, I was able to let the authorities know that I have to go, uh, they were like, "How would you find the means to even travel?" And they were surprised when I suggested that I drive a hand-operated car, so why can't I just go? But by the time all of these conversations happened and all that stuff, the unlockdown 1.0 started off. While that's been my personal experience, but the larger question remains is, how could many people with disabilities get their access to medical care supplies such as catheters, bags, and all that stuff, or maintain their assistive device? It could be the crutches, it could be the wheelchair in terms of damages and all that stuff, or even get medicines while medical shops are still open. How can a person with a disability actually go there and get it? These were the larger questions, and that's been my personal experience.
Thank you very much, Justin. We're going to come back to you with some questions on that, but I wanted to move on to Joe George for a first question to him as well. Joe, could you give us a brief overview of your disability inclusive disaster risk reduction project? Were you able to put into use any of the best practices from your U.S. Department of State exchange back here on the ground?
Thank you, Sean, and the American Consulate in Chennai for this program, which is very relevant. Um, since 2015, Kerala State Disaster Management Authority has been implementing a special project known as Disability Inclusive Disaster Risk Reduction. As you are aware, the Sustainable Development Goals, the motto of SDGs, is leave no one behind. With this objective in mind, State Disaster Management Authority launched a project which brings together persons with disabilities. As you said earlier, around the world, 15% of population lives with some form of disability. In Kerala, around 800,000 people live with disabilities. So it was our endeavor to make them safe from the repeated hazards and emergencies which were in the state. And hence we kicked off this project wherein we tried to bring in capacity building and training initiatives to help them to prepare better for such disasters. As you are also aware, we had repeated floods in 2018 and 2019. In 2017, we had a cyclone, and presently we have COVID as well as we had a landslide last month. So the state especially is prepared for various disasters. And to bring in inclusion into disaster risk reduction, we thought of helping the persons with disabilities to capacitate themselves to better be aware about various disasters that may affect them. And in 2016 and 2017, these 2 years, we spent preparing appropriate materials friendly for persons with disabilities. As you may know, when we talk about capacitating them, we need materials which are friendly to them. For example, if a person is visually impaired and they have to read, so we have to prepare materials in braille or in audio formats. So is the case with persons with speech and hearing impairment. We have to have sign language as we have it right now by Shabina. So that is how we bring in inclusion. And we started training persons with disabilities across the state. We have 14 districts in the state of Kerala, and all the districts had 4 days each training for visually impaired, speech and hearing impaired, locomotor disability, and intellectual impairment, people with intellectual impairment. So we brought in caregivers as well as persons with disabilities themselves. So they were appreciating this initiative of the state government, that they were the first ones to come in for such a training. The training included survival skills, first aid skills. For example, if there is a snake bite, what they should be doing. If they have to give a CPR, how they should be giving it, administering it. So such basic life skills were given, by which their confidence were built and they were better prepared to respond to such disasters. And that was our experience in the past disasters when we did a survey as to what was the impact, how was it impacted the trainings and impacted you. We were asking them. And so they were around 90% of them said it helped us to prepare better for disasters. The second question that you asked is whether we brought in any lessons from the US visit. I would like to say that, mention one example that while I visited, I saw certain materials prepared for persons with disabilities, especially visually impaired, materials in big font, big size fonts. So recently this year, when we prepared the emergency kit materials, so we made it a point that aged people, elderly people, persons who have low vision can easily read with high colors and also big fonts. So this was one initiative which we replicated in the state, along with many other examples also, which time does not permit me to explain. So this is the initiative that we started, and most recently this year onwards, we have also started giving away early warning messages in sign language. Till now we didn't have, or I don't think rest of the state also has this initiative, but we started an initiative which gives in sign language early warning messages, and we disseminate across such population who cannot really hear. So these are some of the initiatives that we started in the state. Thank you.
Thank you very much, Joe George. And I will have some further questions for you, but first I want to give a first question to Shruti as well. Shruti, in what ways have you brought into focus the issue of disability and disaster management?
Thank you, Sean, for giving me this opportunity today to speak here. So we are basically a cross-disability organization, and adding on to what Justin and Joe George spoke, when it comes to disaster management, we'll have to take into consideration cross-disability and multiple disabilities that an individual might have, which means it increases his vulnerability and risk when a disaster or an emergency situation arises. So as an organization, we deal with, or we interact a lot with organizations, companies, and multinationals when we conduct access audits. So the first thing that we do is when we look into their health and safety procedures and mechanisms that they have in place, we always try to sensitize them about how accessible such systems are within the organization. It's very surprising because we've had many instances where the companies are not aware of the accessibility issue behind each mechanism that needs to be provided. Number one. Number two, there's also this perception that when you say disability, they don't think beyond locomotor disability. So they are aware of disabilities, but they don't think beyond a ramp or railing, for instance. So in such cases, we try to sensitize them about, especially the top management, about cross disabilities or invisible disabilities, such as in the case of a deaf person, where you will not be able to, or the colleagues or the buddies system, even if you have for a locomotor disabled person, they may not be aware of a person who is deaf because it's invisible. There may also be employees who have intellectual disabilities. So in such instances, people don't know how to react, and the person who's disabled himself might not know how to react. So it is very important for us to sensitize the management, even when they're at the stage of building an office or conducting an access audit. So that's what we do. So when we try to sensitize them, we also address the perception that sometimes they have, which is that inclusion and accessibility only matter to a small percentage of the population, and therefore they're not going to be very cost effective. So such sort of mindsets is what we try to open up when we interact with these organizations. So we try to tell them, just like Joe George said, when we talk about signage, we try to tell them that the colors or the fonts that you've used might not be very accessible for a person with low vision. So what do you do in that instance? So that's where we guide, because most of these buildings, they have a fire evacuation system, they have a separate procedure for that, they have staircases, and what happens in the case of the lifts not being, or the elevators not operating, or at that point cannot operate. And there will also be instances where an individual might lose his cane and he might be a blind person. So when the peers or the colleagues in a panic situation, when they have to look at this individual, they won't be able to know that he has a disability. So it is those kind of situations that we sensitize the management about. So besides this, so once they have an idea about how they have to place the warning systems, so they are able to understand the different disabilities that exist and how they can adapt their systems to meet these requirements. The other thing that we do is sensitization programs, especially for the frontline professionals such as ambulance drivers, police personnel, who we have found out that they are interested to know about how we can interact with the person who is deaf. So that's where we promote sign language classes where they know how to interact with these individuals, or how to sensitively handle a person who may not be able to understand instructions at that point because they have an intellectual disability. And the third thing that we do is through our magazine called Success and Ability, we try to connect people who work within the disability and the disaster management sector, who have field work experience, who have a lot of data with them, and we try to connect them, such professionals, with our pan-India audience, which has created enough dialogues and conversations in the past. So that's how we do it.
Thank you, Shruti. And just to remind people, you are from the Ability Foundation, correct?
Yes, that's right.
Okay, great. I want to go back to let's go back to Justin. Justin, how do you have any suggestions for how the system could have been improved to help you and people in your situation?
Sure. Thanks for the question, Sean. So, obviously, having a seat at the table will certainly help when these planning and the initial discussions are going on. This will help eliminate the unconscious bias and blind spots while planning. Fundamentally, be it the authorities, the government, or any organization that works in the space will have to understand and realize that there has to be nothing about us without us. So anything that's planned for us has to have our representation. Otherwise, there's going to be obvious unconscious bias without realizing what exactly is being done, because ultimately the persons with the disabilities are the ones that actually go through that situation. As much as persons without disabilities try to think through, in real-time situation, they will not be able to crack what exactly the person with the disability goes through. However, there is a larger problem, right? In your opening remark, you quoted a World Bank estimate which says, the number of persons with disabilities in India is anywhere between 55 and 90 million, right? So if for a second, if we think about that number, it's 55 to 90. That's a huge gap. Uh, World Bank estimate having so much of a range difference. That's primarily because there is no clear statistics. Contrary to that, the last government census update pegs that number somewhere around 30 million. The paucity of statistical data is the biggest challenge that needs to be addressed for any planning or implementation that we do. Once that is sorted, then we'll have to look at the communication channels, because there is a wide spectrum of disabilities that we are talking about, and there is no one way of communicating to them. It has to be, across the entire spectrum in different means and modes. So I did see a lot of circulars and notices that were in the government website carrying the guidelines. So two questions there. How do we actually, convey this to the end user, given that close to 50% of this population with disability is not educated? Secondly, while the guidelines were circulated, the implementation did not seem concerted in reality. I think that needs to be addressed, because there is probably a possible information loss that we're talking about. These guidelines, often do not reach to that last local authority who actually interfaces with the person with a disability. So that needs to be addressed to eliminate any possible information loss.
Thank you very much, Justin. Let me put this to Joe George. Something Justin said brought up a question in my mind. Is there a set definition for what is a disability? And maybe Justin should pop in on this as well, and perhaps Shruti. I want to kind of start with Joe George on it, but if the rest of you would like to join in, let's talk a little bit about that. Justin identified, I think, that sometimes, or actually it was Shruti, I think, sometimes employers think of disabled people as merely people who are mobily disabled. What, if anything, does the government of India say about what constitutes a disability?
The definition per se, Sean, talks about what a person can or cannot do in its definition. So if you look at the word, there is still a discussion about how you should even coin the word. For example, some people don't agree with the word disabled. Some people call it specially challenged. And then Government of India had itself come up with another word. But if you look at the definition, it says there are certain activities that a person cannot do or cannot do when compared to a person without disability. So that is where the understanding is. That's why I said when employers or management officials, even within the government, the State Department, they do not think beyond, they are not aware of what a disability could mean to a person, what can be defined as a disability, and they don't ask the individual himself. Sometimes the best definition can be given by the individual himself. So this is what I can do, this is where I need some assistance. So that's where the understanding is, and that is the barrier that we are trying to break, because it's the straightforward way to understand would be to ask the individual directly. Because if you look at the law, it doesn't clearly define what disability is. It just says with respect to what one person can do and what the other cannot do, and where some assistance is required.
Thank you, Shruti. And let me put it to either Joe George or Justin on this one. Is there an equivalent, or in the United States, we have something called the Americans with Disabilities Act. Is there a law in India that lays out specific protections for persons with disabilities, telling employers, businesses, the things that they must do, things that they cannot do in order to aid persons with disability? That's to say, with the law aiming to aid persons with disabilities with this kind of protection. Is there something similar in India?
All right, I'll go with that. And I'll probably take a minute to answer the previous question that you asked in terms of definition of disability. So the Government of India, the Ministry of Social Justice, does define the different categories and types of disabilities. I think it's broadly around 7 to 8 categories in terms of seeing, hearing, speech, movement disability, mental retardation, mental illness, and I think there's also multiple disability and any other form of disability, and there's a spectrum around that. So that definition is clear from the ministry. Now, yes, there is an equivalent for ADA. We have the rights of persons with disability that was passed and ratified 3 years back in 2017, which articulates what are the rights and what will happen if people with disabilities are discriminated, both from an employment standpoint and from social different social walks of life. However, when it comes to employment standpoint and in terms of rights, there are several requirements that a corporate is supposed to do. But not doing it, that enforcement and penalizing the organization for not adhering that enforcement has not been strict enough. But yes, there is an act and clear guidelines in terms of the do's and don'ts.
Thank you, Justin. And received a question from one of our viewers, which, Justin, although you just answered this one, I think you'd be a good person to answer. What is the impact of India's accessibility campaign for differently abled people? Any practical assistance in your life, the lives of people that you know, Justin?
Sure. So the accessibility campaign, what it has done is largely in the government offices and the way the government offices function from a physical infrastructure standpoint, and also for the need of signages, tactile floorings in some of the areas, that's been covered. However, from a society standpoint, there is a lot still to be done. For example, public transportation. Access to public transportation, they are two different concepts, right? One is a bus or a metro. So while the metros are accessible, how do you get to that metro station? That is still not accessible. That last mile connectivity is still not accessible. So there has been some impact. Government offices have strictly, followed that from a physical infrastructure barrier, or in some cases, having that braille material in terms of information consumption and giving it to the person with blindness. But from a transportation standpoint, or even in a road, if I have to go, there are no walkways for me to go, or if there are walkways, there is no curb to get into that walkway. So I think in those aspects, we are still miles to go.
All right. And I'm going to ask the speakers to try to speak more loudly. Having a little bit of problem with your audio, Shruti, so probably a bad connection there. But if everyone could try to speak a little bit more loudly and more clearly, that will help our translator and our viewers. So let's see. I'm going to ask a question of Shruti now. Shruti, in what ways have you brought into focus the issue of disability and disaster management? Shruti, your microphone's off. There you go.
Sorry, yeah, I just answered that question, Sean, through our access audits and sensitization programs and through our magazine.
Yeah, you did mention the
I'd like to
magazine.
add to what Justin just spoke about the Accessible India campaign, when thinking about media, the role of media in when it comes to disaster management, because the media that is currently available for everyone is not really accessible, because there's not been any initiative from the government to make, say, for example, television channels or smartphones, which seems to be the device that people go to. So any sort of an announcement or protocols or whatever, especially in a situation like this, in a pandemic, at least for the state of Tamil Nadu, there's been quite a bit of interaction from the Greater Chennai Corporation with the public. They've been active on social media and other things, where they've been prompt in giving out warnings and instructions, but they're not necessarily accessible. And when it comes to state level or city level policies, which they want to, when you think about implementation, there's not really much of a thought or a discussion on how accessible the content or the materials that they use for people with disability. So that is something that I would like to add to what Justin said when it comes to accessibility.
Thank you, Shruti. What about with, I'm going to keep on you for a moment there, Shruti. Has the Ability Foundation coordinated at all with first responders to make them more aware of what of the different challenges that are out there, the differently abled people?
Yes, we have. We have conducted awareness programs and sensitization programs with the police personnel and ambulance personnel in the past. And so these are the people that we have dealt with. And often we have had questions from them as well. They have talked about this, and they have welcomed our programs. And they wanted to know about how do we interact with when a person cannot hear, how do we communicate with them? And when there's a person with intellectual disability, or if it's children on the autism spectrum, what do we do? And that's where we tell them how they can produce materials, how they can speak to such people with disabilities, and have promoted sign language also, the basic sign language that they can use to interact with these individuals.
Thank you, Shruti. I'd like to go back to Joe George. Joe George, what you were talking about, what Kerala has been doing, sounds particularly impressive. I'm wondering about, has there been any thought of using it as a model for other states in India? Have other states approached Kerala to ask them about the program that you've got going there? Or have you thought of approaching other states to advertise what you're doing?
That's a good question, Sean. Yes, when we started this project, we didn't have a national model, and we were looking for various materials on disability and disaster risk reduction. Justin was saying that we have to have persons with disabilities also in the planning process. And that's how, when we designed this program, we invited persons with disabilities at large, along with the disaster managers, when we designed a module in 2016, which is available online in print, in digitally, as well as in braille prints. So that can be downloaded and that can be used by the public. When we designed this project, we requested National Disaster Management Authority also to help us in the project. While we were waiting from them, the state government earmarked certain budget for this project, and we started implementing. In the year 2019, that is last year, the National Disaster Management Authority came forward with a guideline on disability inclusive disaster risk reduction, which applies to the entire country, all the states. And yes, some states had asked about our experience and the materials that we have produced. Some materials we have shared with other stakeholders also, like some government agencies and also some NGOs, even some UN agencies. We have shared our best practice with them. So they are replicating it elsewhere. So it was nice to see that the initiative, the pioneering efforts that was taken by the state government here in Kerala was like a model for the other states.
Thank you, Joe George. I appreciate that. That's very impressive. Justin, how about a very basic question? Why is it important to be inclusive, to take into account persons with disabilities in disaster management planning?
Thanks, Sean. So the way I'll answer this question is I'll go to the fundamental fact that, even for a second, let's forget about emergency preparedness or during the times of disaster. But even for the society in large, why is inclusion important? Researchers say, very, very top class researchers say that economies lose around 5 to 7% of their GDP when they don't include people with disabilities. Now, in India's case, where we're talking about over 2 trillion as GDP, we are talking about a number around 100 to 120 billion dollars of GDP lost because we are not being inclusive, right? And in emergency times, right? How are people with disabilities any different? And I think the most important thing is to build a community, a society, or a country that is barrier free. Only when you have barriers that needs to be knocked down. Only when you build a flight of stairs, you need a ramp for it, right? Why not think about universal designs where the environment itself is barrier free? Then we'll not have this challenge of doing something separately or differently for people with disabilities. And I think that's the fundamental thing that authorities, design organizations, or the entire community and society at large should think of in terms of inclusion.
Okay, and I think I'll put this one to Joe George. How can governments integrate special adjustments for differently abled persons into their disaster management policies? Justin, feel free to jump in on that at some point as well, and Shruti, you too. But let me start with Joe George on that.
Thank you, Sean. When we started building capacities with the persons with disabilities, as I said, we were conducting training across the state. Around 3,000 persons with disabilities attended our trainings. When we introduced various skills and helped them to have an hands-on experience by practicing such skills, they were really appreciating the efforts of the state government, and they during the training they were also suggesting various activities which we can further look into, and one was to have the early morning messages inclusive of disabilities. And in the recent times, as you are aware, in the COVID situation during lockdown, Justin had an unfortunate experience. But in Kerala, what we tried to do was to have a 24/7 helpline facility for the speech impaired people. So we generally tell the communities to call so and so number for help. But how a person with speech impairment can talk? So in that note, we started an initiative wherein WhatsApp video calls are made available, and persons with disabilities, especially speech impaired, calls to this number, and we will have an interpreter 24/7, and we also have experts to speak and to respond the concerns by the caller. And the initiatives, this initiative, when we took, the responses were given timely to them, and the solutions were also made. Out of the total calls, we had around 400 callers to this number, and out of these calls, one of the very critical requirement they raised was to provide them batteries, because as you are aware, many of them use assistive devices, and most of them, the hearing impaired persons use hearing aids, wherein batteries are needed. So over a period of time, during the lockdown, the batteries got drained, and they had to replenish the batteries. But the shops were closed, and they had to travel, and public transport was not available. So the callers gave in this concern to this helpline number, and we intervened by providing stocks to the districts, and also to distribute it, door delivered to persons who are in need of such batteries. So these batteries were given. So it's the case with the supplies. When they were in the lockdown condition, they wanted certain supplies, which we provided during the lockdown. And also we also provided counseling services. Many of them had psychosocial impacts, and we with the professional counselors' help, we provided counseling services. So in all this, we try to bring in inclusion in our day-to-day operations of the authority. Also bringing in various stakeholders, because we cannot do it alone. So we had National Institute of Speech and Hearing functioning in the state, and also we had Kerala Federation of the Blind and various other NGOs also, like Tunnel. We also had Inter-University Center for Disability Studies under the Mahatma Gandhi University. So all the stakeholders came together to provide certain solutions when they were in need of help.
Thank you, Joe George. Justin, did you want to chime in on that one, or did Joe George kind of cover it for you?
He did, but however, I just want to cross over and pass this comment to Joe. I think Kerala kind of set an example. A lot of states did not do what Kerala did, both from an inclusion perspective, and also overall the way this entire thing was managed. Kerala kind of set an example for all other states to do that. So I'm super happy and glad that happened. However, just a small request would be that while we all read in newspapers that how the good work that Kerala did, and setting an example in terms of the overall disaster management, how inclusive Kerala has been for other states to emulate, and even people within Kerala, for them to know that these were all done. I think we can do a little more to let people know and communicate that, and over communication never hurts in this context. So I sincerely urge, if that is something that that can be done for a lot of people to actually see and use those services, that will be super great. Thanks.
All right. Thank you. Thank you very much, Justin. So a question for Shruti. Can you discuss the role of media in disaster risk management and disability protocols? Start with Shruti, but if Justin or Joe George have something to add on that, then we'll let you chime in afterwards as well. Shruti, to you.
Yeah. Just like what Joe George and Justin just mentioned, I think some of the practices that the Kerala state has done during this period of time is something that we can take off with respect to media. The role of media itself is very powerful in situations like this, especially when you're talking about new lockdown protocols and other things. So one has to think about what is the most accessible media? What is the media that people would actually access during a time like this? So if you think about a TV or a radio or a smartphone, that is the media that an individual with disability or without disability is going to go to get his daily dose of information. So when it comes to that, a person with disability, how is he going to access this information? So right now we have a sign language interpreter with us, but that's not the case when you look into the television channels that we get to see on TV. So how does a person who's hearing impaired get that information? okay, so they go on to social media and that's where they can absorb information. So, but then again, we have to think about the socioeconomic factors that can increase the vulnerability of people across the country. So if you take, for example, in Tamil Nadu, when it comes to implementation level, there is no sync between the national policy and what's happening in the city. So you have all these information getting disseminated, but it is not taught in the angle of accessibility for a person who might have intellectual disability, for a person who is vision impaired. So how do we get the message across to him? And for a person who is hearing impaired, or a person who is on the autism spectrum. So one has to think about, especially during a disaster, whether it's man-made or whether it's during something like this, or if it's going to be floods and we're stuck in a building, so how do you get the information across? So that's how powerful it has to be when whatever tips or guidelines or instructions or warnings that that goes out needs to be given in multiple formats, and it has to be live. So that's how we can reach everyone, especially in a time like this.
Thank you, Shruti. And I'm going to ask you another question. This one is coming from a viewer specifically for you. What should the role of NGOs be? What are the gaps in current inclusion practices? So I don't know if that second piece of it is speaking about NGOs and specifically, but let's start with that. What should the role of NGOs be in the inclusion of persons with disabilities in disaster management preparation?
I think the main role of an NGO should be to sensitize every stakeholder involved. Whether you take employment, whether you take education, I think the role of NGO is to connect and is to sensitize the stakeholder, because they are the voice of a huge number of people facing a situation. Say, for example, like I said about access audits before. So what is our role in that, if you think about it, is to talk for people with disabilities who are going to be eventually employed in the workplace, or they should also sensitize the management about how a person can become disabled at any given point in time. So when you think about how the policies of a company is framed, they often think about women in general, but probably not women with disability. Or they might think about a woman who becomes pregnant, but then they don't think about a disability per se. So that's where the role of NGO comes. Similarly, when it comes to education, it can be both the child who has a disability, or it could be a staff with a disability. So that's where we talk and we sensitize the management. Have you thought about how your physical infrastructure or the materials that you produce or the communication channels that you have, are you aware whether these are accessible or not? Have you thought about a person with disability, how he or she is absorbing materials? For example, it could be a mere PPT or a platform like this, which is now being used extensively, like the Zoom chat. So like now how we have Shabina doing the interpretation. Have you thought about all of that when you're speaking to your employees, when you're connecting with them? So that's where the role of NGO comes. We become the voice for people who are actually caught up in an inaccessible environment, and then we take up the role of sensitizing a person or people without disabilities to think about them and then bring in inclusive practices overall.
Thank you, Shruti. Appreciate that. Now I've got a question from a viewer that is for Joe. Joe, tell us about what considerations come into play for supply chain management, and how do we keep the supply chain moving with respect to persons with disabilities in disaster management response? There's so many requirements, and supplies and deliveries were completely cut off at certain points. Can you comment on that?
Thank you, Sean, for this thought-provoking question. I would give two examples how we managed to do that. In 2018, as you may be aware, we were hit by floods, severe floods in 2018. And we found through the Social Justice Department, which is the nodal department for the persons with disabilities, we mapped the needs of persons with disabilities, especially many of them, they lost their assistive devices. Plenty of them lost their devices like, daisy players, So how we can replace it? So a list was taken by the district authorities. We have district disaster management authorities who network with the social justice department officials, and a demand was raised in the government as well as in the public. As Rudy was saying, NGOs also played an important role to supply such materials or devices which were in need of the need by the persons with disabilities. With regard to the COVID lockdown period, as I mentioned earlier, batteries were required, and at the state level, we tried to procure the batteries which were available elsewhere, like in Mumbai and Bangalore. So we procured such batteries and we distributed it from the state capital across the state till the northern part of Kerala, and that is not enough. It is reaching the batteries in the headquarters, district headquarters, is not enough, and people are living in rural parts of the districts. Then we used our volunteers. We engaged our volunteers widely so that they can carry it on their motorbikes and two-wheelers, and they without any cost, further cost, we delivered it, as I said earlier. So that is how we try to bridge the gap between demand and supply. And a mechanism was made through the virtual world, like this helpline, inclusive of language interpreter, and the demands were raised and that was supplied timely. So in a way, we could satisfy the needs of persons with disabilities during the emergency period.
Joe, stay on for a second because you said a very important word that I want to jump on. Volunteers. How could someone get in touch with your organization? And I'll put the same to Shruti and frankly to Justin as well. The role of volunteers. How does a person volunteer? How can they help you? Starting with you, Joe George.
Okay. So after the consecutive floods in 2018 and 2019, the state government of Kerala started a new initiative, started a new department, I should say, Directorate of Sannadha Sena, that is a Malayalam word, which means Directorate of Volunteers. This is the first of its kind in the country. No other state has it. And our Honorable Chief Minister gave a target to have one volunteer for 100 community people. So one volunteer for 100 people. And we started raising volunteers across the state in all the districts, and I am actually proud to say that today we have achieved the target. We have more than 3.5 lakhs of volunteers serving in the state. So these volunteers are local laymen, skilled and unskilled people who have volunteered for various activities, especially to work in emergencies, and their profiles are with us with the department, this particular department, and they are being given training. For example, they have been given first aid training. So as you may be aware, the local community would be the first responder in case of any emergency, any disaster. So then the uniformed forces or the professional help will reach them. Prior to that, the local community should be available readily in their vicinity so that help would be timely. For example, a person who's drowning and you need immediate help. By the time we call a fire brigade or people to rescue a diver, all that, it will take time, and just after 5 minutes, the person is no more. So in such critical times, volunteers are very important. And we have engaged such volunteers in the past. As I said earlier, we have engaged them to deliver batteries, deliver supplies, to cook food in the relief camps, and various other activities they were engaged in the state. We also are aware that there should be an institutional mechanism to sustain volunteers. They have to be engaged even in peace times, not only during emergencies. So we have ask them to help the school children to get trained in certain skills like life skills or first aid skills. If they are trained enough to train others, definitely we are asking them to be engaged, and also various other initiatives undertaken by the government. So that is how we keep them going. So the volunteerism definitely is very much needed. Kerala has seen a lot of volunteers in the past due to the repeated emergencies and disasters in the past 45 years, and they are ready and willing to come forward and help us in times of need.
Thank you, Joe George. Shruti, rapidly to you, does your organization have any need for volunteers, and how, if so, how would they get in touch with you?
So in our programs, we usually engage with volunteers in any activity or any event that we do. And all the volunteers, all that they need to do is just to directly contact the organization, and they become a part of our database. And as and when a need is there, we reach out to these volunteers, we have discussions with them, we give them training just prior to the activity or the event that we do. And then we sensitize them as to how to handle different situations. So we do have a volunteer bank that we use for all our activities. But having said that, after the Chennai 2015 floods, which is when we saw a maximum of volunteers getting together during that particular disaster in the city, at the city level, you do have a volunteer bank that is curated by the Greater Chennai Corporation. But if you're going to ask me whether they are sensitized about disability, I would say no, or very limited training is given. There are no repeated training programs. There are no streamlined operations for that. But they do have, it became quite a bit of development after the Chennai 2015 floods. But yes, training is pending and they need to be sensitized as well. So I don't think the city level government is doing that.
Thank you, Shruti. To Justin, what best practices from other governments are you aware of that could be adopted in India?
Sure, thanks, Sean. So I'd answer this on two counts. One, governments that have been really successful in terms of inclusion practices regularly or in emergency or in crisis situation have comprehensive databases in terms of what are the different types of disability, who are they are able to quickly reach out and identify that person with a disability to understand all their complications, reasonable accommodations that are required and all that stuff. So that's something that some of the governments have done. Secondly, I know for a fact a lot of countries in Western Europe and in America, they have research institutes that do very detailed research to understand the quality of life of people with disabilities. For example, in the US, when I went for the Global Sports Mentoring Program as a visitor, exchange visitor, I had the opportunity to interact with the members of an organization called NCPAD. It's called NCPAD, NCHPAD. Now, this center, National Center on Health, Physical Activity, and Disability. Now, what they do is they come up with inclusion policies. They connect with all the stakeholders, and they kind of in a very concerted effort propose to the government what are the changes that are required in different situations, in a regular situation or in an emergency situation, where they cover the person with the disability, the family where there is a member with a disability, the caregiver interest, and what are the possible guidelines that the employer needs to follow. Everything is kind of very comprehensive, and this is operated under the federal government. So it becomes very comprehensive when you have that kind of an institute, which actually goes about and researches the quality of life of a person with a disability. I think something like that would definitely help, apart from the fact that I suggested that a comprehensive database of people with disabilities.
Thanks, Justin. If you could stay on for a second, that kind of dovetails into a viewer question for you as an athlete. Do we promote inclusive sports in India, or do we just need separate sports for people with disabilities compared to people without them? I mean, is there a way of including people with disabilities in the sports and the teams that exist now? Do they need to be separate? What are your thoughts on these?
Yeah, so sports for persons with disability, depending on what your disability is, there are separate competitions and events that are already happening at international level, world level. Obviously, you have Olympics for people without disability, and then you have Paralympics for people with disabilities. So if you have a physical disability or you are a person with blindness, then you can participate in Paralympics. And obviously, at different levels in India, at state level and national level, you have those competitions where you can participate, qualify for internationals. If you're a person with deafness, you can participate in Deaf Olympics. If you're a person with some of the intellectual disabilities, then you can participate in Special Olympics. So there are multiple competitions that happen at international level and national level. There are specific sport bodies that actually do this. However, this is not as strong as you see in some of the Western European countries and in the US, where all of these are part of either school or university programs, where there are school teams and university teams with the disabilities that they compete against each other. That's an ideal situation to be in. But that said, there are separate organizations in India that promote all of these sports. Something to be desired is that these organizations start promoting these at grassroots level, develop the sport, and then bring it up, than waiting for somebody to approach them and then help them participate in different competitions.
Yeah, thank you very much. Just as you made me think about my past career. I used to be in the U.S. military, and we had something called the Wounded Warrior Games, where we were specifically inviting wounded soldiers from various countries around the world to come and have a kind of Olympics in the United States. So there's an example. What about, this one is going to be to Joe George. How do you help people with disability in post-disaster reconstruction? That's a viewer question for you, Joe.
Thank you, Sean. Yes, in the post-disaster phase, we have to handhold them so that they recover faster and help them to cope with the immediate loss that they would have encountered. So in 2018, again, I'm speaking from my example in the state. In 2018, when we had the severe floods, around 17,000 plus houses were damaged completely in the state. So it was a huge task for the state to rebuild what was lost. So much so, in case of persons with disabilities, the wound was much more deeper, because they have to build a house for themselves, as they are more of them are from the socioeconomic poor conditions. So the state took a decision. There is a relief code in the country which allows the state government to give a relief amount to that particular family to construct a house, which is not sufficient, as you may know. The amount which government is giving should be matched with the person who is actually building the house, which is manifold. Then that person cannot really do it from his own pockets. And hence we came up with a project called Pratyutthanam, that is resurgence, which helped the persons with disabilities to construct their own houses. More than 300 people lost their houses, who were persons with disabilities, lost their houses completely. So this project helped them with additional financial assistance so that they construct their houses better. And while they constructed their houses, the government of India, with the Chief Minister's Distress Relief Fund, along with the UNDP Special Assistance Funds, we provided them 25,000 Indian rupees as a special assistance to help them to have inclusive houses. by which we asked them to have ramps to their houses, wide doors, so that they can navigate with their wheelchairs to the washrooms or verandas and all that, and also help them to have a not having round knobs, the door knobs, and having a suitable door knobs and locks and other accessories within the house. And by providing such initiative, by providing such guidelines, we also had issued issued to them a brochure in the vernacular language, so that they follow it and they apply it while they construct their houses. We also had initiatives wherein we provided technical support through shelter hubs, uh, having in many places across the country, especially in the 7 districts where the flood was hit very badly. The shelter hubs provided with some engineers and technical help, and also some counselors to help the persons who are reconstructing with materials in the sense to give technical guidance in procuring materials, and also certain standards which they should follow, which they should comply while reconstructing their houses. So by giving such timely guidance, around 4,569 families could get back to their normal lives by providing this special assistance. And this assistance was provided to persons with disabilities, bedridden patients, cancer patients, and others who were physically immobile in their house. So by doing such activities, in a way we could ensure that post disasters, the reconstruction and the recovery to the earlier part. It's more, as we say, it's more. It was more like a build back better, or bouncing back to the earlier position. So this was one of the examples that we did in 2018.
Thank you, Joe. Question for Shruti. Shruti, a viewer question. How can persons with disabilities and DPOs, by which I believe they mean disabled persons organizations, be active contributors instead of passive recipients in the movement to assist disabled persons in disaster management?
I'm just going to put my video on, hide the video because my internet is a little iffy. Is that okay?
That's fine. Thank you.
Yeah. So when it's a DPO, I mean, Ability Foundation is a DPO by itself. You get to add credibility to the notional figure that the stakeholders are thinking about. So you get to give them. You get to open up their minds in terms of thinking about how a person with disability is going to look at the whole situation, and what is the requirement, and what will be their need, and what would you do if you were in that position. So that kind of thinking can open up when you discuss and when you consult DPOs or an NGO spearheaded by a person with disability, because they are the ones who can give you the direct input when you consult them on any matter, because they will help you think about, or they will assist you in thinking about what might be the requirement and how they want to be included or treated when it comes to decision making. So I think that is the level of input. Did that answer
Thank you, Shruti. I think this next one would be for Justin. Possibly Joe George may want to chime in, and Shruti, as always, feel free to if you've got something to say on this. But a viewer question: how can the state machinery, so the government, have data or access or gather the data on disabilities? I presume they mean by the number and types of disabilities in the country, in their states, in their regions. And make them fully available to respond to the needs of persons with disabilities.
Sure. So there are multiple ways of going about this. To start with, we have census going on. We also have Aadhaar card, which is, the ID card for Indian citizens that's widely used. I think when we collect all of this data, I think it's very important to get all of the information as much as possible in an exhaustive way to understand the different types of disabilities and categorize it appropriately and collect that information and store it in a database. That's one way of doing it. The other way of doing it is, obviously the government of India has some tax benefits for persons with disabilities. So that is again a huge database that is there that can be accessed. And the third thing is, when a person wants to avail certain benefits, they go to the district medical officer to get a disability certificate. Now, all of these are happening in silos in different places in different forms. Now, there has to be a comprehensive database that integrates all of this in one standardized format. Once that is done, this in conjunction with what different organizations, NGOs, where they have members with a disability, that can be, also taken into account, and one comprehensive database. That would be probably the best way to go about in terms of getting that database up.
Thank you, Justin. Joe George, what about in Kerala? Are you doing anything to address that? The same question that we just had?
Yes, sure.
Basically gathering of information on the amounts and types of disabilities prevalent in your region?
Yes. Kerala, in fact, was the first state in the country to do a household census in 2015. The nationwide census happens every 10 years. In Kerala, an initiative was done by the Social Justice Department through Kerala Social Security Mission to map all the persons with disabilities residing in the state. And it was a house-to-house survey which was done, by which we ensured that around 22 types of disabilities, persons with disabilities, their address, their whereabouts were, the data was stored with the local panchayats, local self-governments. So in 2015, when we did this census, the report is available online. When we did this census, we found that around 800,000 people are living with disabilities in the state. Thereafter, when we did planning at the local self-government level, that is panchayats, municipalities, and corporations in the state, the disaster management template which was given to these local self-governments had a specific portion to have the number of persons with disabilities and other vulnerabilities. Around 10 types of vulnerabilities were given, and such information should be mapped and be made available with the local governments. Why it is so? That is mainly to help them during the time of emergencies. When there is an emergency, as we all know that all cannot be rescued and evacuated equally. There should be a priority in evacuation. People who need special assistance, special care, special protection, like children, women, elderly, persons with disabilities. So they have to be, given special care. So when the first responders come in to rescue you or persons with disabilities, the first responders should know where they are residing. So the local authority has the data with them, and this data would be shared with the first responders so that timely rescue would be done by the first responders, and they would be moved out into safe locations. Especially during the COVID time, this time we had severe rains also in some districts, and we ensured that this COVID protocols are also maintained while they were rescued from their residential areas. So special care is taken by the state governments. Just to add one more point in this time is that the Rights of Persons with Disabilities Act actually gives a list of 21 types of disabilities. The earlier legislation, which was passed in 1995, that is Persons with Disabilities Act, had only 7 types of disabilities, wherein this was updated further, and 21 types of disabilities have been enlisted as the definition, as you were asking earlier, the definition, disability by definition. So more types of disabilities were added to the previous list. Thank you.
Thanks, Joe. Really quick, very briefly on this one. Joe, how can the public access materials prepared by the Kerala State Disaster Management Agency? Very briefly.
Yes, the materials which we have been preparing in the past are available on our website. That is www.sdma, that is State Disaster Management Authority, .kerala.gov.in. So the handbook is available under the handbook section on the website tab, and the videos which we have produced are also available on the website. Along with that, we also run a YouTube channel on which we have sign language videos on 6 different hazards, especially prone to Kerala, including Corona. I would like to add saying on 10th, as early as 10th February this year, we launched a video on Corona prevention awareness video. By doing such initiatives, we ensure that the information dissemination takes place and the public can access the website. Now, we also have various braille materials available with us, which can only be sent via courier or by post. So such materials are available in English as well as in local language, for which you may have to send a request over email or on the address which is mentioned on the website. We have been distributing such materials to the schools run for the specially abled and also various NGOs in the past. So we continuously try to disseminate the information that we have, and we would welcome if viewers would like to have a copy of such information and materials. Definitely we would be happy to provide.
Thank you, Joe. Shruti, over to you. This is a viewer question, what are the steps taken by the Ability Foundation to provide an accessible environment for people working from home due to the pandemic ongoing now?
Okay, so we are regularly in touch with the employers, organizations where we have helped hire persons with disabilities. So based on the information on our database, the first thing that we did as soon as we in this situation was to connect with employers and speak to them, brief them about the possible requirements for their employees with disabilities, sensitize them as to if this is the disability they have, this is what probably might have to provide. And we have also had, invite input from persons with disabilities currently working from home, and if there's any requirement that they have, they reach out to us and we communicate this with the employer. Most often, the employers are already briefed by us, so they are able to provide, or they're able to interact with the employee directly, and they're able to provide them the necessary features. The other thing that we do is we also try to connect our sign language interpreters who are in our database, and if there's any sort of meeting that they need, they can also, the employee, they can, or the person can always reach out to us. Companies reach out to us when they're conducting meetings, and if there's a requirement, they reach out to us, and that's where we help. The other thing that we do is we also conduct upskilling programs online called Linkability, where the graduates and working professionals who are looking for a better opportunity, they all are part of this upskilling program. And that program by itself is very accessible. We have a sign language interpreter. We ensure that the platform is accessible, where there's captioning, subtitling, everything is available. So that's also how we try to assist people looking for jobs or people currently in jobs who want to upskill themselves. And we also do this for students currently held up back home. We have placed a number of students with disabilities in different in engineering colleges. So if the staff, if they have to attend any sort of online classes or anything like that, we also assist the staff with sign language interpreters, and with platforms like Zoom and other things, sensitize them and create awareness about the technological advances that are there, any apps that are available. We also put this up on our social media so that everyone is aware of the kind of apps that they can use when they're at home. And we also have people can also reach out to us to our office landline or WhatsApp videos, and we help them out that way.
Thank you, Shruti. So next question, and I think this may be for Joe. Shruti, jump in as well if you've got information on this, and let's keep this one brief. But I've got a viewer who is specifically interested in helping indigenous people in the mountainous areas, and would like to know how they can join with the government to assist in helping disabled people, disabled indigenous people in the mountain areas. Anyone specifically have any expertise in that?
That's a appreciable offer which he has made. In Kerala, what I can suggest is we do have institutional mechanism in all the districts. If, for example, mountainous areas like Idukki or Wayanad, we do have interagency groups in all the districts, which is headed and chaired by the district collector, respective district collectors. So we have around 400 NGOs working alongside with the government in the state. So they meet often, especially when there is an emergency, or if not, otherwise they meet maybe once in 6 months or so. So this particular person, whoever has offered, can contact the district administration and also be part of the interagency group, and definitely we will take your expertise in times of emergencies or otherwise when there is a need to help persons in mountainous areas having disabilities. Definitely we would appreciate that help. Thank you.
Thank you, Joe. Appreciate that. And a viewer question as well, and I think this one's also pointed at Joe. Specifically, would like to know Kerala's measures adopted to ensure online education reaches children with disabilities, particularly in rural areas, and perhaps particularly given the current situation of the coronavirus pandemic.
It's quite a relevant question for this time. Yes, we have challenges in ensuring, imparting online education for persons with disabilities, especially children with disabilities. We have introduced some projects called Maravil in Malappuram district. Maravil is rainbow in Malappuram district, where the teachers will find some time to have extra efforts to reach out to children with disabilities. We also have something known as bud schools, where children with disabilities, especially intellectual impairment, are catered to. So in such cases, in such schools, the local self-government officials and the people's representatives in that area takes an extra care and effort to reach out to such children, and also to provide additional coaching to them. We also had a meeting just 2 days back with the education department, which the department themselves conducts special coaching to the trainers as well as teachers, so that they reach out to children with disabilities, having adding some more time, and also interacting with parents. One of the challenges is also to give physiotherapy while this lockdown period. So various videos were prepared by Social Justice Department, this particular agency, also to give an online tutorial to the parents on how to give physiotherapy from home-based care. So such initiatives were done in the state.
Thank you, George. That was impressive. So now we're going to come to the final question of the night, and I am going to give it to all three of our panelists. I'm going to start with Shruti. I'll ask George, and I'm going to let Justin finish up. So starting with Shruti, but all three of you get the same question. A viewer has requested that the three panelists come up with key recommendations to the government to be more effective during disaster management, disaster situations. Shruti, give me your top recommendation.
The recommendation would be for the national government to ensure that all the state and city level policies and action plans are in sync with the national policy. And the comprehensive guidelines that are normally issued during the course of a disaster or a pandemic such as now won't do. And once the road to recovery happens, the government needs to involve people with disabilities for consultation at every stage, not only when preparing for a disaster, but during the course of disaster, what has to happen. So a much more in-depth plan has to be prepared with the input of people with disabilities. And this has to be across disabilities and not just one or two. And the government should also ensure that the national policies reach down to the bottom level, to the field workers, and all the other policies are in sync with the main act.
Thank you, Shruti. George, briefly to you, give me your #1 recommendation to the government. And that can be the government of India, that can be state governments. #1 recommendation on this.
See, I would say personally, we have come a long way in terms of having persons with disabilities included in the disaster risk reduction activities. Progress has been made, much progress has been made in the past, but of course that is not enough. We have to move ahead with much more activities and interventions for persons with disabilities. As we generally say, disasters affect everyone, but persons with disabilities are affected disproportionately. And hence, much efforts should be taken by the government, by NGOs, by persons with disabilities also, helping them, strengthening them, equipping them to face disasters and emergencies in their life. So one recommendation, if you ask, I would say that the first responders, the uniformed forces and other first responders in the country should also be trained on disability inclusion, especially with some functional knowledge of sign language. This initiative we are starting very soon, that the NDRF, the police, the armed forces, Army, Navy, Air Force, the fire personnel, some of them at least will have certain number of personnel trained in sign language, functional sign language. So when you go to respond or to rescue a person, the person has to speak to a person who cannot speak. So how to do that? So at least a basic sign language induction training to the first responders would be much appreciated, and it is much needed. And also to deal with persons with intellectual impairment. And such people may not even understand and comprehend that it is fire and it will harm them. So how do you convince them to come out of the house or come out of that danger area? Sometimes helping them will do much more harm because they may not cooperate with the first responder. So how to deal in such emergencies? How to help such people? So that would be, as you asked, just one recommendation. So I would post that.
Thank you, Joe. And Justin, over to you. You've got the last word on this. What's your top recommendation to governments, Indian governments, state governments, international governments, what have you? Give us your best.
Sure, thanks. So I think the most important thing is not a single section of people should be left behind when you're planning for this. While you can look at intersections, please ensure that you do not apply one size fits all solution for these kind of situations. And to sum up, a recent United Nations survey across countries, when they reached out to people with disabilities, only 10% of the respondents said that they are confident that their local authorities or governments can actually, manage their expectations in terms of when there is an emergency crisis or when there is a disaster, which simply points to that fact that either the systems are not there to give them the confidence, or they are not aware of that systems that are existing. So either ways, the government has a responsibility to either put the systems in place or to make sure that people with disabilities know that there are systems. So that's something that the government should take up.
Thank you very much, Justin. And that brings us, ladies and gentlemen, to the close of our program tonight. I want to end by thanking all of you for listening and watching. I would like to thank our panelists, Justin, Joe George, and Shruti. But perhaps most importantly, I think we need to all thank Shabina Chudari, our Indian Sign Language interpreter here, for making this a good example, for making this accessible to hearing impaired people. So everyone, a big thank you to her and to our panelists. Thank you from the U.S. Consulate General in Chennai, from the U.S. Consulate General in Chennai, for being here tonight. Thank you to the Kerala State Disaster Management Authority. Thank you to the Ability Foundation. Thank you to our panelists. Thank you all. Good night.